Terrible. RSV straining hospitals across the country now. The surprising surge is striking earlier this year and filling hospitals to the brim with children. The CDC reporting pediatric beds are at 75% capacity across the country. And it's even higher here in Minnesota. In the metro, 97% of pediatric beds are in use. And it's been like that now for quite a while. Beds were at 99% capacity for children at the beginning of this month. This year, RSV is a little different. Lockdowns apparently weakened our immune systems.
So while RSV tends to target infants, older children are also getting sick.
So it was kind of shocking because I thought for sure it was COVID or the flu. RSV wasn't even something that was on my radar.
Only tonight in our 10 at 10, you'll hear from a mother who was terrified when her 5-year-old son got sick with RSV. And while RSV is spiking early, we're getting closer to cold and flu season as well.
And shortages of a drug nearly every parent has had in their medicine cabinet could not come at a worse time. Mary McGuire joins us live. Mary, some pharmacists are scrambling to find alternatives to the common amoxicillin.
Yeah, and this medication is commonly used to treat bacterial infections, especially in children. And today I reached out to CVS Pharmacies, one of the largest chains in the country. They tell me that they are seeing sporadic shortages of this medication and that they're working with manufacturers to try and rectify it.
Just in time for a winter spike in illnesses, 3 major drug manufacturers are reporting a shortage of the popular antibiotic amoxicillin. Commonly used to treat ear infections, the majority of the supply problems were found to be in the liquid form of the medication, which is popular with kids. One of the drug companies is blaming the shortage in part on an increase in demand.
Any supply issue for something like this is concerning.
Clinical pharmacist Keith Karski says they've been feeling the impact of the shortage in the Central Care Clinic, urgent care, and emergency department.
What we're seeing is that kind of some of these strengths are coming and going.
He's monitoring the situation daily.
The pharmacy might not have that strength, but they may have another strength. So they will, recalculate the dosage.
As cold, flu, and infection season gets underway, Karski says the shortage has the potential to get worse. He tells Fox 9 his staff is prepared to work with providers to find another alternative medication or can locate another pharmacy that may have the drug.
We do all we can to pivot to what the next best option is.
Now, at this point, the shortage is really being felt in different places across the state. I did reach out to several large hospital systems here in the metro. They say that they're doing fine when it comes to supplies, but those smaller independent pharmacies, I reached out to dozens of them across the state, they are feeling the pinch. So it really depends on where these places are getting their supply of amoxicillin. Reporting live tonight, Mary McGuire, Fox 9.
All right, thanks, Mary.